Hello, welcome to week 4. If you're following along on the topic outline, you'll see that our topics for this week include the Human Genome Project, nursing roles in genomics, or the role of professional nurse, and the ethical, legal, and professional issues that are involved in providing care to clients with genetic health disorders. If you're following along in your textbook, please refer to chapters 18 and 19. The text is really good for explaining this material. Does a pretty good job. So I'm sure you're all sort of wondering, what is the role of the generalist nurse in regards to genomics? I sort of feel like I'm teaching, you know, social media back in 2002. Before it was a big part of everybody's lives, before we knew how much potential it had to influence politics, marketing, even healthcare. Um, Genomic healthcare is sort of in that stage of development. A lot of exciting things are happening, but it hasn't really become part of the public's vocabulary in healthcare. Um, as you guys graduate, take your NCLEX, and move into practice, you're going to see an increased role for the professional nurse in genomic healthcare. The reason for that is pretty obvious. Nurses have the most interaction with patients, and patients are usually comfortable with nurses. We have a way of communicating with patients. It's part of our training and socialization, and people trust us. Um, the most important role at this moment is to take a good history. With careful history taking, nurses can identify many red flags that indicate inherited risk factors for health problems. You are going to see this next week in more detail when we discuss how to take a history that includes familial risk and how to construct a pedigree. Pedigree is sort of like a map of who's in your family, what health problems they've had, whether they're alive, what they died from if they are not. And it gives us a really good understanding what genes might be lurking in that family tree. And you'll have to excuse me if I don't sound my usual self. I am home sick recording this video, but anyway, we'll press on. Nurses need to be able to provide accurate information about health and genetic risk. This is important. Um, you might be the first person that somebody encounters um, in your healthcare setting who takes this history. It's up to you to be able to explain intelligently the person's risk factors, what their screening options are, how they can modify their lifestyle. Many of the diseases that we're going to look at later in this semester have an epigenetic component. Epigenetic is the combination between the environment and our genes. You have a gene that predisposes you for chronic obstructive pulmonary disease. There is a gene for that. If you don't smoke, your risk of getting that disease, if you're not exposed to secondhand smoke, is much lower. So, helping people understand how to modify their lifestyle is also in our wheelhouse, and it's important. If you don't do it, nobody might. Discussing diagnostic test results. Now, most of us who've been in practice a while have had the experience of a provider coming in, telling a patient that they have tested positive for XYZ or that their levels of something or other are abnormal. And as soon as that provider leaves the room, the patient says, "Can you explain that to me? I'm not sure I understood it." And so we need to have that information in order to share it intelligently with our patients. Nurses also oversee referrals to genomic professionals when appropriate. We've all heard of nurse navigators. I hope you have, especially in cancer care. It's okay to say, "I understand the basics of this, but you really need to see somebody with a little more expertise. I'm going to refer you to a genetics counselor who can help you understand this information." And you make that appointment for them. This happens in prenatal care, it happens in pediatrics when we discover that a child has an inherited condition. And so that's also an important function of the nurse. Nurses advocate for patients. It's one of our most important roles. A patient has the right to autonomy. That's the right to make the decision that's best for them. That includes the right not to be tested for something that may have an inherited component and not to receive results if they have opted for that testing and now are no longer interested. Um, it includes the right to receive care based on the information. So, those are all important roles. One last um, point is that with the ethical issues that surround genomic medicine and the chance for genetic discrimination, discriminating against people based on their genetic testing, we are going to talk about that at the end of this lecture. Um, Confidentiality takes on a really enhanced role in how we share this information with other people. Um, if you're sharing it and there are other people in the room, always ask the patient, is it okay if I talk in front of your spouse, your coworker, whoever's in the room? You don't always even know who their visitors are. But you need to be aware of confidentiality with this information. Okay. The primary role, just to underscore what I've just said, primary role for nurses in healthcare is to ensure that the influence of a person's genetic history on health and disease is considered as part of a general assessment. When you are doing that global intake, it's important to note what their family risk factors are. It impacts their care. All healthcare professionals are expected to have a basic understanding of terminology in genetics and understand the basic patterns of inheritance. Nobody is expecting you to be a cellular biologist, but you are expected to know, for example, if a patient has CF, what is their chance of their sibling passing it on to someone else? If they have sickle cell trait, what is their chance of having a child with sickle cell anemia? Um, we all should have some understanding of that because it does impact the care we give to our patients. Advanced roles for nurses in genomic healthcare, there are some. There used to be an advanced practice certification through the ANCC. They have stopped doing that. You can only keep that credential, you can maintain it, but you can't seek it as a new thing. But there are advanced roles for nurses in genomic healthcare. Genetics nurses work in a variety of settings. It includes specialty clinics for patients with, let's say, CF or sickle cell anemia or beta thalassemia. So we can work in those specialty clinics that address the needs of people with known inherited disease. Prenatal and reproductive medicine centers, this is taking off now. The testing has gotten less invasive with non invasive prenatal screening. Um, And so just about everybody at every age is being offered genetic screening, and the results are coming in, and people have a lot of questions. So you could work in prenatal and reproductive medicine centers, fertility clinics. Cancer centers are using genomic medicine at an increasing rate. And so there is a role for nurses with advanced certification in genomic healthcare. Public health settings, understanding population health when it comes to genetics, and also research centers for people interested in that. The role for the advanced genetic nurse includes risk assessment, healthcare management of genetically linked disease within the nursing scope of practice, patient education, direct nursing care, counseling, and research. There is an organization called ISONG. It is the International Society of Nurses and Genetics, and it offers two certification programs. They just sort of started this in 2018. There is a certification for a clinical genomics nurse. You have to have a baccalaureate level of education or above, and you need to work in a specialty that incorporates genomics. You also need to take an exam that demonstrates competency with the basic um, concepts and professional skills of the genomics nurse. Advanced clinical genomics nurse is their other certification, and this is for advanced practice nurses with a master's degree or higher, so clinical nurse specialists. and nurse practitioners working in an area that incorporates genomics. So there is that sort of advanced role, and that will become a bigger thing in healthcare as we move along. There are other professionals who work in genomic healthcare. There are genetic counselors. These are the people you are most likely to meet. These folks have advanced training, usually a master's degree in genetics. They communicate with and counsel patients at genetic risk. So they work in all kinds of places. Um, I've worked with a few in my work in maternity, and they are good at helping people understand what their risks are and what options are available to them for screening or treatment. We have clinical geneticists. These are doctors, MDs or DOs, physicians who have completed a residency in the management of diseases with genetic components. They diagnose and treat genetic disorders. So they're doctors who specialize in genetic medicine. There are medical geneticists. They don't have a medical degree. They usually have a PhD with some specialization in public health, like epidemiology, population health. And these folks consult with genetic counselors about risk recurrence, and most of them teach in universities. There are many other professionals. There are bioethicists who sit on ethics boards and make decisions about what kind of research is allowed and what kind of treatment somebody with a genetic disorder should have or not have. There are legal specialists who work in genetic medicine. There are many other professionals. Your book in chapter 18 has a pretty comprehensive list of them. But the three that you're most likely to encounter in your practice as a nurse are these: genetic counselors, clinical geneticists, and medical geneticists. And I'm going to stop the video here, but come back. We're going to do some cases in the next one.